I appreciate the opportunity to speak. I'm Joe Stapp. I am a psychotherapist. And the reason why I'm here today is because we've done a lot of discussion about Common Core, the standards. We have smarter people than I coming up and saying how that is described in the text and the theory behind it. I'm here to talk about how this is impacting kids, because that's primarily why we're doing this. How does this impact them emotionally? And I have seen that this has been a real problem. I've been a therapist for about 20 years, and I work with kids from 5 years old on up to college age. I also work with adults. But I'm seeing an increasing amount of depression, of anxiety, of drug abuse, and we have cutting and other problems that are out there. Now, I'm not saying that Common Core is the sole reason for it. I'm saying that it is definitely a major contributing factor to that. And I want to just address some of the things that I see are problems from a developmental and emotional level. I thought it was interesting because I was not here all day, but I perused through this, and I saw that at 10:50 a.m. there was a discussion about Common Core bringing calm to the classroom chaos. And it seems like the chaos is being taken out of the classroom and it's starting to be put into the family. What I'm seeing right now is a disintegration between the family, the teachers, and the kids. All three of those at one time were necessary in order to fully educate a child. Now, I'm a parent as well, and I know that I haven't been able to access any of the curriculum from the school. And I've heard that from other parents too. They've requested it. What is my child teaching? I've been told that there aren't enough textbooks, so we can't have you come in. I've offered, let me sit in a room at school. I would be willing to take a look at that. And that has not been allowed either. So what I see there is there's a disintegration between the teacher and the parent. The other thing that's a problem is when a parent has their child come home with homework, if they do come home with homework, which seems to be diminishing these days, they're not really able to understand some of the teaching that is happening in the classroom. I know my son, for instance, came back, and I'm not a geometry expert, but I do know that some of the angles of a triangle equal 180 degrees. We took a look at his problem that his teacher said, because he was very confused and the rest of his class was confused as well. And I hadn't been in geometry for a while, so I looked online to find out what exactly is the process of coming up with this answer. And it didn't follow what was stated online. So I thought, well, you know, knowing the internet, there's some bad information out there. So I went to another site that also gave me the formula for figuring out what the angles could be. And that was not the answer at all. We plugged in the figures based on a formula that were online, and we could not come up with the right answer at all. So I guess there's a different way of coming up with the answer, but I know I felt very disconnected from the teacher at that point because I have questions. I can't help my child learn this information. And I'm hearing this from other parents as well. Basically, what I wrote down here is I'm noticing in our discussions we're teaching to the test rather than teaching to the child. The standards really don't follow neurocognitive development. If we take a look at the development of a child, in elementary school age, their frontal lobe is not really well developed. It develops over a period of time. We pretty much thought that the brain, the functioning of the brain was based on size, and it's not. And we've, as a result of looking into it, realized that the brain develops in different stages. The reason why kids act up and they say rude things in the classroom, etc., is because they're doing a lot of their thinking from the limbic system, which is the emotional part of your brain. The frontal area is where you have reasoning and thought, and I'm presented with a problem, and here are the different ways that I can derive that answer. What I'm noticing is that with the curriculum, there's a flip-flop that's going on, which is very interesting to me and a concern. For instance, elementary school kids, and I've been asking the parents of the kids that I counsel, as well as the kids, and some teachers that I'm also doing counseling with right now. I talked to a kid that was in 4th grade, and he was told to read a story and then tell how that story matched the story of his family. Now, that child, based on where he is developmentally in his brain, he can tell you the story of his family. He can tell you the story that he read, but as far as linking those together, that requires a higher level of thought that his brain is not able to accomplish at that time. Now, the opposite side is where we have the kids that are in middle school on up. And this is a personal example, once again, with my son. They had a poem called "We Wear the Mask" by Paul Dunbar, which is a very good poem, and basically describes how African Americans had to wear a mask in order to get along in a white world. And they were asked to come up with a theme, and his theme was that you should be a good person and live an honorable life. And he was told that that was wrong. Now the correct answer was be yourself. Now, I'm not an English major. My wife graduated in the top 5% of her class in English. She took a look at that and realized, oh, wait a second here, there's really not that much of a difference. And even if the teacher disagrees, you could mark it down, but he failed. In fact, most of his class failed. Now that's an opportunity for them to learn critical thought, but that wasn't encouraged. So basically what he's being told is, I want you to guess what the answer is. That's not teaching critical thought that these kids have to be able to have in order to go forward into college and beyond that. So that's what I mean by a flip-flop. Kids that are in elementary school are basically told that they have the ability to reason. Kids that are in school or in grades beyond that are having to stop their critical thinking and instead be able to read the mind of the teacher, which is essentially reading the mind of the text by the teachers that I've heard. Other problem I can see is the learning styles differences, disabilities are not taken into account. I haven't heard one person talking about that yet. Kids don't all learn the same at all. You have visual, you have kinesthetic, you have oral, you have logical, you have physical, you have a lot of different ways that kids learn things. And unfortunately, from what I've heard from the standards, basically what this comes down to is we're going to instruct the kids so that they can pass a test. Well, what if this kid doesn't have that ability to sit in the chair and to be able to write out a paragraph and to answer other areas of that test? That kid's not going to be doing very well. So the problem I can see is we're not doing an adequate job of measuring whether this child is adequately learning the material or not. I know a lot of very, very smart kids that have difficulty learning from an oral point of view. They have to write out the information and understand it, and then they get the better grades as a result of that. So I'm not hearing how that's happening. If it is being differentiated from the other kids who are able to learn that way, that's fantastic. But my concern is, from what I'm hearing, everything is going to be the same, that this test is going to be implemented, and that's where it gets into mental illness there. I have kids that are high functioning, kids that were in honors classes that are now suffering with depression. I have an 18-year-old who started smoking marijuana for the first time. Now, like I said, I'm not saying that Common Core is the cause of that. What I'm saying is it's a major contributing factor, because I asked him what's going on in school, which is a typical question I will ask everybody to see how they're functioning. And he said, I don't know what I'm learning. It seems as though everybody in my class, including my teacher, were very confused on what we should be learning. So he was talking about math and how he got the right answer, but he got it wrong because in his work he couldn't write an argument to show why he derived that answer. And that's what I'm hearing from a lot of other kids too, is when you have a problem, you're supposed to write a paragraph on how you got to there. Now, all of us had teachers that said, show your work. There's nothing wrong with that. But it seems as though the amount of writing for just coming up with an answer of 2 + 2 = 4 is getting outlandish, I think. The other thing is just the teachers I talk to. And the good teachers are really having to teach against what they know as best practices. I know that you're able, from what I've heard, you're able to take the information and implement it great. I haven't heard that from other teachers I've worked with. I haven't heard from one teacher that likes the curriculum. I've heard from many who have said that they are supposed to defend it when the teachers or when the parents come in for parent-teacher night. And they're given talking points on how do you explain this to the parents. But a lot of them are having to go against what they see are best practices. And I have a quote from a teacher that I thought was important. She said, "A one-size-fits-all approach is the new standard rather than meeting kids where they are. We are to teach to the test rather than the students. Many of my students are going to feel confused and discouraged, and they aren't alone. I also feel the same way because I have to embrace something with a smile on my face when I know it's not going to be for the students' futures. How do you defend something to parents when you agree with them?" So these are the concerns I have. If you want to see where things are progressing, look at the suicide rate in Japan. They have a national test that they take. That test determines their future. That's why you have a high amount of suicide. They take this national test, and if they don't score where they need to be, they bring shame to their family, not just to themselves, and they commit suicide as a result of that. Now, I don't think that we're going to see a bunch of suicides as a result of that, but we will see kids who struggle with that because I am seeing them. I am seeing how they struggle emotionally. I'm seeing the kids who have always done really well academically talking about suicide. I'm seeing how teachers and parents are being driven apart from each other, and the kid is being lost in the middle. I do family counseling, and one of the things we try to do is get the family together. Let's work on this communication. This is actually a formula to bring greater derision among those different aspects of this system that's meant to help the kids. So if we continue this without stopping and taking a break, and not only taking a look at the educational theory, but also what is the emotional ramifications of this, I think we're making a big problem here, and we will see it increase. So what I would ask you to do is think about this. Are we truly testing, are we truly teaching to the test rather than teaching to the child? Do you have any questions?
I don't think so.
Okay.
Why do we have one?
I'm curious about how long you've been seeing this happen in your practice, because I can't argue with any of this, but it's also interesting because some of this starts when they transition from kindergarten to first grade, where it's not quite as fun. I mean, so some of this stuff is normal and it's been going on since, we were all in school. But I'm curious because we heard this whole teaching to the test is not new, and it's not necessarily connected with Common Core. So I'm curious about how long you've been seeing this in your practice, this stress and this anxiety that your students are seeing, because again, just in my own home, seeing it long before Common Core.
Yeah, last 2 or 3 years, you're correct. As far as the transitions from elementary school to middle school and all through life, there's going to be stress. So it's not as though we're coming from a situation where there hasn't been mental illness and all of a sudden we're starting to see it. I would say within the last 2 or 3 years, I'm starting to hear of kids in elementary school talking about suicide. The psychiatrist I work with is now doing drug tests on 11-year-olds because that's where they're starting to do drugs. I'm seeing cutting. I'm seeing some very severe things within the last 2 to 3 years. I really don't know when Common Core was implemented, to tell you the truth, but I would say I'm very, very concerned. That's why my voice is raised right now, because I'm appealing to you to please take this into consideration.
What school system are your children in?
Dawson
Dawson.
County.
Okay.
Dawson County.
Mm-hmm.
Could you spell your last name for me, sir? 'Cause
Stapp, S-T-A-P-P.
Okay. The only reason I asked, there was a lady earlier here, I think she referenced you, maybe you being in a video that's floating around on
Oh.
YouTube. Is that
Yeah, there's a video.
S-T-A-P-E?
A-P-P.
A-P-P. Thank you, sir.
Yes, certainly.
Videos under Mike Scoopini, isn't that right, Mike? Your videos under your Facebook? Yeah. Joe may have it on his too, so.
Thank you.
Probably.
Anybody
Anything
else? Okay, thank you.